Today, we're diving into a super important topic: 11 symptoms and early signs of heart disease. Heart disease is incredibly common, and it's something we should all be aware of. We'll discuss surprising symptoms linked to heart disease, ones you might not recognize, and why listening to your body is crucial. Sometimes the earliest signs are easy to brush off, to dismiss as nothing. Knowing the signs could be the key to getting help early and potentially saving your life or the life of someone you love. So, let's get into it. Let's start with the most obvious one: chest pain. It might feel like pressure, tightness, squeezing, or even just a dull ache. Any kind of chest pain, especially if it's new, unexplained, or comes and goes, is worth getting checked out. Don't try to diagnose yourself, and definitely don't just ignore it. Your doctor can help you figure out what's going on. Ever notice you're suddenly out of breath doing something you could normally handle just fine? That's not normal. Shortness of breath, especially during physical activity, can be a sign that your heart isn't pumping blood as efficiently as it should be. If you're experiencing shortness of breath more often than usual, or if it's accompanied by other symptoms like chest pain or fatigue, it's time to call your doctor. We all feel tired sometimes, right? But we're not talking about needing an extra cup of coffee in the morning. We're talking about that bone-deep exhaustion that just doesn't go away, even after a good night's sleep. If you're constantly feeling wiped out, it could be a sign that your heart is working overtime just to keep up. If you're feeling that kind of relentless fatigue, don't just chalk it up to being stressed or getting older. Talk to your doctor. Swelling in your legs, ankles, or feet can actually be a sign of heart trouble. It happens when your heart isn't pumping efficiently and fluid starts to build up in your body's tissues. If you notice that the swelling is new, persistent, or getting worse, especially if it's accompanied by other symptoms on this list, it's worth bringing up to your doctor. Don't ignore it. Sometimes you might feel your heart skip a beat, flutter, or pound in your chest. That's called an irregular heartbeat or arrhythmia. While most arrhythmias are harmless, some can be a sign of a more serious heart condition. If it's happening frequently, lasts for a long time, or is accompanied by other symptoms like dizziness or shortness of breath, it's important to get it checked out. Pay attention to how often it happens and how it makes you feel. Sometimes nausea and indigestion can actually be signs of a heart attack, especially in women. If you experience them suddenly, for no apparent reason, or along with other symptoms like chest pain or shortness of breath, it's crucial to seek medical attention immediately. Don't mess around with this one. Pain in your neck, jaw, throat, or even your back can actually be a sign of a heart attack. The nerves that run from your heart to these other areas can sometimes send mixed signals to your brain. If you're experiencing pain in any of these areas, especially if it's on the left side of your body, comes on suddenly, or is accompanied by other symptoms like chest pain or shortness of breath, get to a doctor. Don't ignore it. Sweating excessively, especially when you're not physically active or overheated, can be a sign that something's up with your heart. It's like your body's way of saying, "Hey, something's not right here." If you're breaking out in a cold sweat for seemingly no reason, especially if it's accompanied by other symptoms on this list, it's time to get yourself checked out. Feeling lightheaded or dizzy can be a sign that your brain isn't getting enough blood flow, which could be related to your heart. If you're experiencing frequent or severe dizziness, especially if it's accompanied by other symptoms like chest pain or shortness of breath, it's important to see a doctor. Don't ignore it. A persistent cough, especially one that produces white or pink mucus, can be a sign of heart failure. If you have a cough that lingers for weeks, doesn't respond to medication, or is accompanied by other symptoms like shortness of breath or fatigue, it's essential to see your doctor. Don't ignore it. Heart disease doesn't discriminate. It can affect anyone, regardless of age, gender, or ethnicity. Some risk factors can increase your chances of developing heart problems. Some of these are things you can control, like smoking, diet, and exercise. Others, like family history and age, are things you can't change. Be aware of your risk factors and talk to your doctor about ways to reduce them. Thanks for watching. If you're experiencing any of the symptoms we talked about, don't ignore them. Talk to your doctor. Get checked out. It could save your life, because a healthy heart is a happy heart. Don't forget to like, comment, share, and subscribe. And hit that notification bell for more videos.